My name is James Harrison. I'm now a student in the Liberty University Master of Public Health program. As part of my Health 632 Health Program Planning class in the fall of 2021, and with Dr. Kelly Wheeler as professor of the class, I've put together a health program plan to address overweight and obesity in McCracken County, Kentucky. This is a briefing on that subject. McCracken County is a county in the far western part of Kentucky. Very importantly, the prevalence of obesity, of adult obesity, in McCracken County is 31%. The prevalence of overweight is 67%, and the lack of physical activity among adults is 32%. Therefore, there's a risk of developing serious health conditions, including high blood pressure, high cholesterol, diabetes, heart disease, stroke, and cancer. The proposed county-run program, Live Well McCracken County, is what this briefing is all about. Essentially, it is a solution or a proposed solution to the overweight and obesity in McCracken County. It involves improved nutrition, increased physical activity, and it has a strong focus on healthy body weight. One of its purposes is to educate, encourage, and provide county opportunities for county citizens, and also to advocate for medical insurance to cover obesity prevention. We have a number of program partners who are very important in this effort, and these include county leadership, the medical community, the business community, and citizens groups. There are two target populations for this health program. One of these is overweight or obese individuals in McCracken County, Kentucky. The second are interventions to health professionals, particularly general practitioners, to obtain greater weight loss for their patients. There is a focus on both groups equally. They can both do a great deal to solve this problem in McCracken County, Kentucky. The mission of this activity is quite simple. It is to improve, lengthen, and save lives in McCracken County, Kentucky by preventing obesity. And the name of this program, this health program, is Live Well McCracken County. We will do this through improved nutrition, increased physical activity, and a strong focus on healthy body weight. And as I mentioned before, we will also advocate for medical insurance to start covering obesity. The goals and objectives that we have come in two parts. The first is for adults. The next slide will show the goals and objectives to be attained for children and adolescents. But the first here for adults is keep a food diary, learn to read nutrition labels, stock the refrigerator properly, aim for an average of 60 to 90 minutes or more of moderate to intense physical activity, 3 to 4 days each week. And the end result is by October 1, 2026, this is a 5-year program, reduce obesity by 40% among adults in McCracken County, Kentucky. The second goal is to prevent obesity among children and adolescents in McCracken County. And there are a number of ways to do that, to help do that. For example, to work to change family eating habits and activity levels, rather than focusing on a child's weight. Be a role model, set an example. Reduce screen time in front of the TV and computer. Encourage physical activity, avoid food waste. And the result here too is by October 1st, 2026, reduce obesity by 60% among children and adolescents in McCracken County. This Live Well McCracken County Health Program has a strong link to social cognitive theory, behavior change theory. Key components of that social cognitive theory related to individual behavior change include self-efficacy, expectancies, observational learning, behavioral capability, self-control, expectations, and reinforcements. And they all tie in to this health program. There are a number of interventions which are appropriate for this health program as well. One of them is to use a low carbohydrate diet. Also offer structured, individualized nutrition counseling, computer-tailored nutrition education, exercise, again, of course. Program goals should also target weight management specifically, not other things as well. And multi-component interventions do in fact lead to greater weight loss. As part of this briefing, I want to make you aware of the resources that will be required and involved in conducting this health program. There will be 2 locations in McCracken County for offices and facilities for this program, for the administration of the program, education and training, and increased physical activity. The first, the larger location, will be in Paducah, Kentucky, and that will involve 8 full-time personnel and 4 volunteers. The second location in West Paducah will involve 5 full-time personnel and 3 volunteers. We are taking this health program on overweight and obesity very seriously for county residents, and we will have a lot of information available to help them learn and know what they should do to lose weight or not gain weight. We will have the traditional resources like documents of various kinds of workbooks, flashcards, charts, digital media, especially videos, other open resources like websites, journals, public databases, and testing resources for our program. As I mentioned previously, we will have 2 locations in McCracken County for offices and facilities, one in Paducah and the other in West Paducah. For both of these facilities, we will need furniture, stationery, and other essentials like first aid kits, fire safety, food and drink, cleaning supplies. So both of these locations will be fully equipped to function. Financial resources to operate these 2 facilities will come from donations from county residents, citizen organizations, and businesses. We expect that we will get some aid from the state, some resources from property taxes, possibly user charges and sales and use taxes as well. We plan to focus on 2 groups of people: overweight or obese individuals who reside in McCracken County, and also those who are part of the health interventions to health professionals. There will be no direct cost to the participants. The channels of advertising will be social media, email marketing, blog posts, video, local radio and TV, newspapers, and magazines. Ethical issues related to this program are associated with the Health Insurance Portability and Accountability Act of 1996. That's HIPAA. There are national standards to protect sensitive patient health information, including diagnoses, treatment information, medical test results, prescription information, national identification numbers, and demographic information such as birth dates, gender, ethnicity, contact information, and emergency contact information. This health program is a 5-year program, and we have a timeline for reductions in obesity during that period of time. In the case of adults, we expect a reduction and we strive for a reduction in obesity of 20% in 2 years, 25% in 3 years, and 40% within the 5-year life of the program. For children and adolescents, the reduction in obesity that we attain is 30% in 2 years, 40% in 3 years, and 60% in 5 years. There are strong benefits to participants and the community through the Live Well McCracken County Health Program. These include improved nutrition, increased physical activity, a strong focus on a healthy body weight, less risk of high cholesterol, diabetes, heart disease, stroke, and cancer, less health care spending by the county, and hopefully soon medical insurance will start covering obesity prevention. There are a number of stakeholders who have very strong interest in this health program. The stakeholders include county leadership, the medical community itself, the business community, citizens groups, and those who might want to create a similar program in another health area, so they want to learn about ours. Stakeholders also include target populations eligible to participate in this program, including those 2 categories we discussed before: overweight or obese individuals who reside in McCracken County, and also those involved in educational interventions to health professionals, particularly general practitioners. There are a number of ways that stakeholders are involved, and all of these ways are very important. They can be participants themselves in the Live Well McCracken County Health Program for obesity. They can advocate this health program to others. The medical community itself can help to oversee the health status of participants in the program, donations of money or other resources, ensuring racial harmony, ensuring safety and security, ensuring protection of the environment. The next 3 slides will discuss a logic model which we've put together to address in a more formal way this health program. And the logic model, the purpose of the program, of this Live Well McCracken County program, essentially is to improve, lengthen, and save lives in McCracken County, Kentucky by preventing obesity. And we do make some assumptions here. And one of the assumptions is that the obesity issue is important to McCracken County citizens and providers, and there are resources available to conduct the program. There are 2 inputs, the 2 locations in the county. They together provide a total of 13 full-time and 7 volunteers to this effort. We also need supplies. The first location is in Paducah. The second location is in West Paducah. And these 2 locations provide certain activities in addition to creating timeline and tracking systems, staff training, learning materials, and advertising materials. There are outputs associated with the logic model, and we keep track of those: the number of participants in the health program, the number of education and training sessions that we conduct, number of physical activity sessions, and then with respect to the individuals who participate, the number of pounds lost, and the rate at which they lose those pounds. And then the short range, medium range, and long range outcomes from the program. And in this case, adult reduction in obesity, 20% in 2 years, 25% in 3 years, 40% in 5 years. And for children and adolescents, their reduction in obesity, 30% in 2 years, 40% in 3 years, and 60% in 5 years. These are substantial achievements in this health program. Many thanks for viewing and listening to my presentation. There are many interesting and important things going on in public health. so we'll never run out of opportunities to serve God's children. I hope you benefited from the program and learned from the health program that we just talked about. Thank you. This last page are references listed for the information contained in this slide presentation. Thank you very much again.